If you suffer from joint pain, back or neck soreness, arthritis, or a sports injury and are looking for an alternative to undergoing surgery, then it's time you visit Dr. Charles Tucker at Tucker Chiropractic. Dr. Tucker is a member of the Disc Centers of America and specializes in a low-force approach to chiropractic care. Dr. Tucker is now offering non-surgical spinal decompression, which provides a safe and effective alternative to surgery for those with disc problems. Let's meet Dr. Tucker and find out what made him want to be a chiropractor.
I was hit by a car when I was 10 years old. I developed migraine headaches from whiplash trauma, and I did not receive results from medical professions, so my parents took me to the chiropractor, and that's where I got results. So since I was the age of 10, I've wanted to be a chiropractor. I've been in business now for almost 39 years. So I think what makes my practice special or different is that I continue doing a lot of education, because someone dear to me said years ago that if you don't keep up with what's changing in your profession, you'll be so far behind you can't catch up. So because of that, I've become a certified chiropractic sports physician. I attend a seminar annually for the activator instrument that I use. I'm certified by them. I recently was certified by the International Medical Advisory Board on spinal decompression, so I now am certified to do non-surgical disc decompression. In chiropractic, we manipulate bone structures back into a better position. So I use an activator method. Activator method of adjusting has been around for 50 years. I go back every year because they change the protocol on what we're adjusting, and the instrument has grown along with it, so it's in its 5th generation. It's highly effective. It is a high-speed, low-force instrument. So in chiropractic, when you're moving bone structure, it only moves a couple millimeters. But with a high speed, you don't twist, you don't crack, you don't have to get people into odd positions, especially if they're in pain. It works great for neck pain and low back pain, sciatica, but it also works very well for shoulder pains and knee pains and hip pains. So I recently added non-surgical spinal disc decompression to my office. Non-surgical decompression is a way of healing the disc without surgery. It's been around for close to 20 years. It was invented by Dr. Dyer, a neurosurgeon. Like the activator instrument, it has evolved, and the research that they have done and the machine that they have used has made it highly successful. I got into it because for years I've been telling people the only thing you can do for a bulging disc is go have surgery. That's no longer true. So the way non-surgical spinal decompression works is it's a very slow and gentle pull on a specific disc. You're only working one disc at a time. What that pull does is it creates a vacuum effect. A vacuum effect is like sucking through a straw. So if you cut yourself, the blood brings everything it needs to heal that cut up for 24 hours a day, 7 days a week. The problem with the disc is it does not have a blood supply. Because as the disc dehydrates, it gets narrower like a sponge that's dry. So if you take a sponge and you put it into water, what's it do? It sucks water into that sponge. What decompression does is it brings that nutrients that the body needs and the oxygen in the water to rehydrate the disc and heal the disc. Conditions that you can treat with spinal decompression are chronic neck and low back pain, herniated discs, ruptured discs, people that have sciatic and arm or leg numbnesses and pain, facet syndromes. The only other treatment for bulging discs is surgery. And I think we all know surgery can be very invasive, very painful. It involves a lot of pain, a lot of drugs, a lot of therapy, and you're out of commission for several months. With decompression, there's none of that. The patient walks out of here. Usually the pain diminishes within a few treatments, and then we continue to get the disc to heal so the symptoms don't come back. One session on a spinal decompression unit takes about 45 minutes. The entire series depends upon how much damage there is and a lot of other symptoms. So we take each patient and we fine-tune what their treatment protocol needs are. One of the best things about non-surgical decompression is there's absolutely no pain involved. It is a very slow and relaxing traction. So the patient's laying down on the unit, and while the pulling is happening, because it's so gentle, a lot of people fall asleep. So if you're experiencing chronic neck or low back pain, or you know you have a herniated disc, we'll take a look at it and we'll set up a protocol that will work for you.